Hi, hello everyone. Hope you are doing good. Welcome to Deepti's Academy. My name is Deepti. Today we'll discuss about an important topic from adult nursing, polycystic kidney disease. Before going into the details, I would like to request you to like the video, share this video with your friends, and can discuss or ask questions if you have any doubts. Mention in the comment box. And thank you for subscribing my channel. Polycystic kidney disease, in short PKD, is a genetic disorder characterized by the growth of numerous cysts in the kidneys. When cysts form in the kidneys, they are filled with fluid, destroying the nephrons. PKD cysts can profoundly enlarge the kidneys while replacing much of the normal structure, resulting in reduced kidney function, leading to kidney failure. We can have a comparison of polycystic kidney disease affected kidney with a normal. Let's see the types of PKD. We have two types of polycystic kidney disease. First one, infantile polycystic disease. It's an inherited autosomal recessive trait. And the second one is adult polycystic kidney disease, that is an autosomal dominant trait. Let's see the first one, that is infantile polycystic disease. It's an inherited autosomal recessive trait that results in the death of the infant within a few months after the birth. Autosomal recessive PKD is a rare inherited form. Symptoms of autosomal recessive PKD begin in the earliest months of life or in utero. The second type is adult polycystic disease. It's an autosomal dominant trait that manifests between 30 and 40 years of age, but can begin earlier, even in the childhood, and results in end-stage kidney disease. Autosomal dominant PKD is the most common inherited form. We can have a comparison of polycystic kidneys that is enlarged from a patient with ADPKD, that is autosomal dominant polycystic kidney disease affected patient, in comparison to a normal kidney in the middle. When the cyst forms in the normal kidney, they are filled with the fluid destroying the nephrons. These PKD cysts can profoundly enlarge the kidneys while replacing much of the normal structure, resulting in reduced kidney function and leading to kidney failure. Let's see the signs and symptoms. Kidney stones. Kidney stones occur in about 20 to 30% of the patients with PKD as compared to 1 to 2% in the general population. One reason kidney stones are more common may be due to cysts blocking the tubules, that is the filtering part of the kidney, preventing the normal drainage. The next clinical manifestation is increased abdomen size. When the kidney is damaged by the cyst, it fails to excrete the extra water and sodium out of the body. In addition, there are a lot of proteins leaking with the urine, while the protein has the function of locking water. So the extra water and sodium will cause retention in other tissues of human body, leading to edema. Blood in urine or hematuria is common in autosomal dominant polycystic kidney disease. Gross hematuria is an alarming symptom and may be the first manifestation of ADPKD. Cyst hemorrhage is a frequent cause of hematuria in ADPKD, while other differential diagnoses include cyst infection, urinary tract infection, renal stones or renal calculi, and an underlying malignancy. High blood pressure or hypertension is common and occurs in a majority of autosomal dominant polycystic kidney disease patients prior to loss of kidney function. Hypertension relates to progressive kidney enlargement and is a significant independent risk factor for progression to end-stage renal disease. Urinary tract infections. Anyone can get a urinary tract infection, as you all know, but having PKD can increase the risk of UTIs. One reason is that kidney cysts are prone to infection, allowing bacteria to build up and affect the urinary tract. Finally, back or side pain. Patients with PKD may experience back pain due to muscular changes and degenerative changes affecting spinal joints and disc. How can this happen? Kidney cysts can grow very large, adding weight to the abdominal region. Extra stomach weight pulls forward on the spine and back muscles, causing the spinal arc in the lower back to increase. This shortens the length of muscles in the lower back and creates chronic tensions, hence results in pain. Let's see the assessment of patients with PKD. They may often asymptomatic until the age of 30 to 40 years. Flank, lumbar or abdominal pain that worsens with activity and relieved while lying down. Fever and chills. Recurrent UTI. Urinary tract infection is more common and frequent. Hematuria, proteinuria, pyuria. Hematuria is presence of blood in urine. Proteinuria is excess of excretion of protein via urine. And what is pyuria? Pyuria is a condition of urine containing white blood cells or pus. Pyuria can be defined as a presence of 6 to 10 or more neutrophils per high power field of unspanned, voided, midstream urine. This can be a sign of bacterial urinary tract infection. Renal calculi, hypertension, palpable abdominal masses and enlarged kidneys, increased abdominal girth. Here are the interventions for polycystic kidney disease affected patients. Monitor for gross hematuria, which indicates cyst rupture. Increase sodium water intake because sodium loss rather than retention occurs. Provide bed rest if ruptured cyst and bleeding occur. Monitor for pain. Teach use of pain medications. Avoid non-steroidal anti-inflammatory drugs and aspirin because of the risk for bleeding. And use of dry heat to abdomen and flank areas to comfort themselves while cysts are infected. Prevent constipation from pressure of cyst on colon by adequate fiber in diet, stool softeners, adequate fluid intake, and by doing exercise. Prepare the client for percutaneous cyst puncture for relief of obstruction or for draining an abscess. Administer antihypertensives as prescribed. Prevent or treat UTIs. Prepare the client for dialysis or renal transplantation. Encourage the client to seek genetic counseling and provide psychological support to the client and family. The questions related to polycystic kidney disease will be discussed in the next video. Hope you understand about the content. See you soon. Till then, bye bye, take care.